probably up in like 3 presentations. Can I let you know when I get to the destination? I should only be 10 minutes.
Yes, it'll probably work out very well, Miss Clayton. Thank you.
Okay.
Hang in there. All right. Miss Abelos, are you ready? And can you tell us, this is terrible actually what I gave you because it's, it's a 2-hour presentation. Can you tell us very simply about the lymphatic system?
I can.
Thank you.
I can. And in 10 sentences.
Wow. Okay.
I'm giving you a literary illustration, and it's titled "Security" with an exclamation point. Okay.
I'm already in love. All right.
Okay. So I want you to imagine yourself as a traveler in a line waiting to get through security at an airport. Now, imagine that security line is like your blood moving through your high-pressure circulatory system. The travelers are bits of blood plasma, and the biggest concern of everyone in this line is to get delivered to their final destination. Now, you can't rush through a security line or a blood vessel because if it moves too fast, you run the risk of something bad getting through. So in the case of the line at the airport, every now and then these security officers show up, and they're named lymphatics, lymph node organs, and mucosa-associated lymph tissue. And they randomly funnel these travelers or blood plasma into a slower line to get a full pat down and a bag check to make sure that it's legit. Now, this slower line has a series of checkpoints that are staffed with special security officers called non-specific and specific defense mechanisms. And they have the ability to take care of small infections on the spot, or if they really don't like the looks of that guy and what they found, they can alert the entire immune system. Your lymphatic system is a slow-moving security line with a network of vessels, tissues, and organs that maintain fluid balance and fight infections, and that's 10.
Damn. Okay. That was the best symbolic representation of the lymphatic system I have ever heard in my life. You put me to shame. Stop it. That was really good. That's exactly the whole, what I love is you captured the purpose of the lymphatic system and the theme behind what makes it work. That's beautiful. Thank you, thank you, thank you, thank you. Ms. Carrillo, you are going to try to explain to us interstitial fluid.
Hi everyone. So I don't even know if I have it right, but I drew it to convince me I have it right for just a second.
Well, that's most of life is just faking it. So yeah.
We fake it till we make it, am I right?
Yeah.
That's what I've been doing this whole class, and everyone thinks I know what I'm doing.
Yeah. You got a spool.
Okay.
Oh. Loving it.
All right. So do you see it?
Yes. We love it.
Okay. The interstitial fluid is 11 liters of clear watery fluid, making 26 of water in the human body. Interstitial fluid is made when hydrostatic pressure forces part of the blood plasma to diffuse out of the blood capillary vessels into the interstitial space. So kind of like how you put pressure to squeeze the juice out of an orange. And it's like a stew, where the pot is the interstitial space, the broth is the interstitial fluid, and the ingredients are like the vessels and the capillaries. And this was the simplest way to think of exchanging the nutrients. And in the nutrients in the interstitial fluid, it's water, oxygen, sugar, carbon dioxide, salt, fatty acid, hormones, protein, electrolytes, waste, neurotransmitters, white blood cells, and coenzymes. If pressure in the interstitial space becomes greater than inside the lymphatic capillary, which is the endothelial cells, flap-like mini valves, open in one direction. Flaps push open, take in the fluid to relieve pressure. This is like how pressure and heat from water goes into cooking rice, filling it with water. So it goes from dry to cooked rice. It's still rice, it's just one has now water. So fluid inside the lymphatic capillary, which is our rice, is now called a lymph. This is how interstitial fluid goes back into the bloodstream. And that's my presentation.
That was fantastic. I hope you're proud of that presentation. That was really good. That was really good. I like the soup analogy because that's kind of accurate, and the rice and everything. It was fantastic.
Thank you. It was really hard. It was just really hard because I'm like, what is it?
Yeah.
And then it's like everything, and I'm like, but what is it? And yeah.
I love it.
Thank you. I'm glad
You'd think a shorter presentation would be easier, but I think they're much harder. I think you have to be extremely choosy. And you have to understand your material because you can't just keep, adding stuff to make sure you catch it all. You got to grasp the kernels of the best stuff. And you did. That was fantastic. Thank you.
Thank you. Appreciate it.
No, I appreciate you. Mr. Craven, will you tell us about,
Yes, sir.
will you tell us about lymph nodes?
I can, but first I want to get educated. Hopefully somebody knows the answer to this. What is this called? Like, I want to do something different. Like, what is it called when you take the first letter and just like make something out of it?
An acronym?
Is it an acronym?
I think no.
Like when you write it out like that in every way? Like,
Anybody?
I looked it up. I thought it was like a alliteration or acronym or something like that. It
Well,
wasn't. I couldn't find it.
I think it's acronym. Alliteration is when you use the same consonant over and over again, like calico
Right.
cat. Yeah.
It's an acronym.
Okay, cool. All right, well, I did an acronym. It just so happened to be exactly 10 letters, so there's no way I can go wrong on this, hopefully.
Perfect. Hit us. I love it.
All right, so I'm doing lymph nodes. We're going to start off with L for lymphatic chain. It's based on the lymphatic chain. Y is going to be your cervical, axillary, and inguinal regions. Kind of cheated there. M is moves lymph. P is pathogen removal. H has a bean shape.
Yes.
N is neck. It's very common to have like swelling in your neck. O is the only structure on the chain to filter lymph. D is damaged cell removal. E is ear infection, which is like a common like theme with it as far as like swelling goes in the neck. And S is going to be swelling.
That was awesome. I love how you guys have a theme, like how each of you presents. That was fantastic, sir. Thank you. Thank you. Thank you. I love it. Ms. Clayton, you chimed in there. Does that mean you're ready to tell us about lymph?
No, still driving. 5 more minutes.
You're paying attention, though. I got you. I feel you. Okay. Miss Deng.
Yes.
Can you tell us about the thymus gland?
Yes. The thymus gland is a new organ that you turn cells and it helps fight infections. The thymus gland is usually located behind the breastbone in front of the heart and between the lungs but some of people find this organ found in the leg or upper chest. The thymus gland is very important of the
Endocrine?
system.
Yeah.
Endocrine.
Yes, endocrine. Good.
Endocrine system. The The thymus gland produce several hormones. One is proteins and thymus. Those hormones are involved in the process where the T cells get turned into different type of disease fighters. The second is thymosin. This hormone boosts the immune system's response. Thymosin also stimulates hormones that control the growth. And the third is thymic hormone factor. Those hormones increase the immune system response to the virus. The thymus gland also makes small amount of the hormones produced in other areas of the body, those including maternity,
I'm not sure.
which help to sleep, and insulin which help you control your blood sugar. Thank you. That's it.
That was good. Thank you. Yeah, the thymus gland is part of the endocrine system, and it's the training camp where your T cells go to become really awesome T cells and fight and stuff. And by the way, everybody, your thymus gland, strangely enough, shrinks as you get older, which doesn't seem to be a big deal. It shrinks, it gets replaced with fat as you get older, and it doesn't seem to matter because by the time it's kind of disappeared, you've got all your T cells generated and it's all okay. It takes till age 75 before it's kind of fully replaced and such. But anyway, also some people think the thymus gland has something to do with helping protect you against autoimmune diseases, which is why we often don't develop those till later in life, because the thymus has to shrink and such. So it seems to have something to do with also keeping your immune system in check. Miss Dimitruk, the spleen. Hello.
I cannot. Okay, I'll be presenting.
Please.
Find it.
Go, girl.
The spleen. What is the spleen? The spleen is an organ in the upper far left part of the abdomen to the left of the stomach, and it varies in size and shape between people, but it's commonly a fist-shaped purple organ about 4 inches long. And there's an accessory spleen in about 10% of people that causes no problems and is considered normal. What can a spleen do? Your spleen's main function is to act as a filter for your blood by removing the old, malformed, or damaged red blood cells with macrophages and letting the healthy red blood cells pass through back to the bloodstream. Always economical, your spleen saves any useful components from old cells such as iron in the form of ferritin or bilirubin and eventually returns the irons to your bone marrow where the hemoglobin is made. The spleen can actually hold up to a cup of reserve blood in the blood vessels that are able to get wider and narrower depending on your body's needs. And the spleen can pick out any unwelcome microorganisms like bacteria or viruses in your blood, thus playing an important part in your immune system, which helps your body fight infection. That's a real long sentence. When one of the invaders is detected in your bloodstream, your spleen, along with your lymph nodes, jumps into action and creates an army of defender cells called lymphocytes, a type of white blood cells that produces antibodies, special proteins that weaken or kill bacteria, viruses, and other organisms that cause infections. Antibodies and white blood cells also stop infections from spreading through the body by trapping germs and destroying them. Can I live without a spleen? as you've seen, your spleen is a very useful organ, but it is not vital, and sometimes a person's spleen does have to be surgically removed. And this may be because the spleen becomes injured, or it's taken out in the course of transplanting other organs. Just some fun facts.
Yeah.
Just pictures.
I love it. Nice. I love it. Well done. Thank you, ma'am. And by the way, they say it's not a vital organ. It's not a vital organ because you have lots of redundancy in your body. Spleen's absolutely amazing, but you've got other stuff that will pick up the slack if it has to. If you ever get a major cut, everybody, your spleen squeezes out that cup of blood really quick to keep your blood pressure up. So, very good. Thank you, ma'am. I love the graphics, everything. Everything. Spleen, kind of like a giant lymph node. Mr. Bose.
Hello.
Hi, ma'am.
Okay.
Will you tell us about Payer's patches?
Yeah, hopefully I got.
I'm sure you did.
Okay, so Payer's patches are groupings of lymphoid follicles in the mucous membrane that lines your small intestine. These follicles are small organs in your lymphatic system that are similar to lymph nodes. Payer's patches are considered the immune sensors of the intestine. The function of Payer's patches is to analyze and respond to pathogenic microbes in the ileum. Antigens from microbes in the gut are absorbed by endocytes, by microfold cells lining the surface of each Payer's patch. These antigens are passed on to the lymphoid tissue where they are absorbed by macrophage. Hold on, I don't know how to say that.
Macrophages.
There you go. And presented to T lymphocytes and B lymphocytes. When presented with dangerous pathogenic antigens, lymphocytes trigger the immune response by producing pathogen-specific antibodies. The body then prepares a full-wide immune system response to the pathogen before it's able to spread to the intestines. And as far as massage goes, you would definitely want to consult with your physician if you want to do any lymphatic drainage. And they'll give you some tips on that.
That's perfect. That was great. Yeah, so it's just lymphatic tissue that's right next to your intestines and attached to your intestines, because what's the main source of bacteria getting into our body? We stick it in all day long. Food's got all sorts of stuff on it, not to mention those of you who put your fingers in your mouth and who knows, right? And your pen, I'm one of those people. Anyway, so it makes a lot of sense to have all these immune cells right down by your intestines to make sure it gets all the junk out of there and takes care of that. Miss Clayton?
I am here now.
Miss Clayton, this is the perfect time to tell us about lymph. What the heck is lymph?
Okay. I'm going to share my screen here.
Oh, we got a presentation. Good. Okay. I like it.
Yeah, it's only 3 slides, so
Hey,
don't worry.
It's only 10 sentences, so yeah. That looks like 25 slides, but oh, good. Okay.
It's only 3. Okay. Where's my little thingy here? Go. Okay, so lymph is different than blood, slightly different. Blood contains 4 different things. It contains red blood cells, white blood cells, platelets, and plasma. Whereas lymph only contains the white blood cells and the plasma. So it's just basically this guy, which is the white blood cell, and this guy, which is the plasma, which is plasma. And like Ms. Correa said, it's kind of like rice and the soup that it's in the broth. So there's some differences. We talked about yesterday the differences. So blood is this. Sorry, I'm sitting outside at my spot in the back, so that's a garbage truck. Blood is the main transporting fluid, and lymph is a parallel transporting fluid, and it basically connects the tissues fluid and blood from the blood into the tissues and tissue fluids back into the blood. It only contains plasma and white blood cells. It is colorless. Blood is red. because of the hemoglobin, lymph is colorless. It has fewer nutrients and waste. It travels only in the lymphatic system. It doesn't have gases like blood does. And it only flows in a slow single direction, where blood flows in a full circle. It removes, metabolic waste. And in summary, the garbage can is stuck.
Well, this makes sense. This is the garbage truck is your lymphatic system, and we don't want to get him blocked up. You can't get the bulk trash out of there. Yeah.
Yeah.
Good timing.
Literally, this is really annoying.
Lymph is blood light.
So in summary, I'm inside now. Lymph is it is blood light, like instead of Bud Light, and it's designed to fight. It's a superhero because it brings nutrients and it destroys bad guys, and that's it.
That was great, though. Oh my gosh, blood light that's designed to fight. I wish I could absorb everything I'm learning from you guys. Thank you, ma'am. Thank you.
Uh-huh.
Wonderful stuff. Okay, Miss Everson, will you tell us about red bone marrow and why it has anything to do with the lymphatic system?
Yeah, I will do my best. Short and sweet.
Short and sweet is good, and we can hear you. I'm just turning up the volume a little bit, but yes, you're good.
All right, you guys disappeared. So, red bone marrow is located in our bones via the skeletal system and consists of a delicate, highly vascular, fibrous tissue containing stem cells. These stem cells produce all red blood cells and platelets. Around 60 to 70% of lymphocytes in human adults. Other lymphocytes begin life in red bone marrow and become fully formed in the lymphatic tissue, including the thymus, spleen, and lymph nodes. So you need the red bone marrow from your bones to produce the lymphatic system.
Yeah. So true. That's exactly it. Yeah. I didn't want to cut you off. Was that it? Good. That's perfect. No, it's true. Your bones make your blood and your lymph. Essentially, they make a lot of your white blood cells. So that's exactly what's important about it. Perfect. Okay. I'm just going to mute you. Boom. Mr. Godot. Mr. Godot, what the heck are lymphatic capillaries, lymphatic vessels, and lymphatic trunks?
All right, let's see. All right, hold on. I have it like broken down into sections.
Sure.
So, all right, let's see. All right, lymph. Okay, lymph or lymphatic capillaries are tiny, thin. Oh shit. Okay, hold on. Give me 1 second. Okay, lymph and lymphatic capillaries are tiny, thin-walled vessels closed at one end and located in the spaces between cells throughout the body. In the central nervous system and non-vascular tissues, lymphatic capillaries are slightly larger in diameter and have greater oncotic pressure than blood capillaries. And then I have lymphatic vessels. Lymphatic vessels are the network of capillaries, microvessels, and a large network of tubes located throughout your body that transport lymph away from the tissues. Lymphatic vessels collect and filter lymph nodes as it continues to move towards larger vessels called collecting ducts. And a lymph trunk is a collection of lymph vessels that carries lymph and is formed by confluence of many efferent lymph vessels. The lymph trunk the lymph trunks drain into the lymph ducts, which in return returns lymph to the blood by emptying into the respective subcapillary veins.
Yeah. Cool.
All right.
That's it, sir. It's perfect. So everybody, it's just like a tree, literally. Tree trunk, the vessels are branches, the lymphatic capillaries are the twigs, right? And it just, things get bigger and bigger and bigger as they head back to the heart, as Mr. Godot said perfectly. Thank you, sir. Ms. Clayton, you have your hand raised. I'm assuming that's left over, but I want to make sure. I'll take that as a yes. Miss Green? Miss Green.
Hello?
Hi, Miss Green. Hey, Miss Green, will you tell us about the right lymphatic duct and the thoracic duct? What are these two different ducts? I don't get it.
Okay, so I wasn't really 100% sure what you wanted me to say, so I'm just roll with me.
Neither was I, Miss Green.
But the right lymphatic duct basically drains lymph from the right side of the head and neck, the right upper extremity, and the right half of the upper trunk, and delivers it to the right subclavian vein. The thoracic duct drains lymph from the rest of the body and delivers it to the left subclavian vein. I found that the right lymphatic duct starts on the right side of the esophagus.
Esophagus?
They spell it different. Like it's like OESOPHAGUS. Is that just esophagus?
It's not spelled right. You're right. I'm embarrassed. I don't know either, Miss Green.
Okay, sorry.
Don't be.
Well, we're gonna go with esophagus.
Okay.
But as it ascends through the thorax, the thoracic duct passes behind the esophagus at T5 to reach its left side. The lymphatic system and the function of the lymphatics is to remove this and return it to the venous circulation. The thoracic duct drains into the subclavian vein, while the right duct drains into the right subclavian vein, both at the junction between the respective vein and the jugular vein. The lymph ducts each have internal valves at their junction with the subclavian vein.
Cool. I love it.
Okay.
That was great. So basically you've got subclavian, by the way, just means under the clavicle. You've got big veins underneath your clavicle, everybody, and they're heading back to the right atrium of the heart. They're bringing black blood from everywhere. And the lymphatic system dumps into those because it knows those are going to the heart. Right? It's cleaned up all the stuff from all over your body. It dumps it back into these subclavian veins. They go in the right atrium, then we start the whole process over again. Well done. Thank you, Miss Green. Nice. Miss Hendrickson, how do I move lymph? Do I put something on an airplane? Move them across? I don't know.
Right.
Okay, not quite. All right.
Okay.
I'll let you explain.
All right. So there's some ways that you can move lymph. Regular exercise is key for a healthy lymphatic system. Rebounding or jumping on a trampoline is one of the most effective forms of exercise to improve your lymphatic flow. Acupuncture is another effective treatment that will help you stimulate lymph flow and help remove toxins from the body. Lymphatic drainage massage is also very effective, but a regular massage will also help, just not as directly. Hot and cold showers. So hot water helps dilate the blood vessels, and cold water shrivels them, which creates a pump action that forces out fluid to move through the body. Hydration, so it's advisable to drink up to half your body weight in ounces of water per day, because when you're dehydrated, the lymph becomes sludgy and sticky, and it doesn't move as well. By wearing excessively tight clothing, you're reducing circulation in the lymphatic system, so avoid those skinny jeans. The pumping action of deep breathing will help the lymphatic system transport the toxins into the blood before they are detoxified by the liver. So deep breathing. Eating raw nutrient-rich foods promotes a healthy lymphatic system, such as leafy green vegetables, low sugar fruits, flaxseed, chia seeds, avocado, garlic, Brazil nuts, almonds, walnuts, and cranberries. And then there are also many herbs that can be very helpful for the lymphatic system. especially in a T form, including echinacea, astragalus, wild indigo root, golden seal, cilantro, oki root, and parsley. And that's everything I have.
That was fantastic. That was stuff I didn't even think about. Thank you. So I should bounce, poke, stroke, bounce, poke, stroke, drink, eat plant-based diet. And
for some reason.
and that throws all the herbs in and everything. So yeah, awesome. Thank you. That's very cool.
Thank you.
That was really cool. I like that. Mr. Jones, sir.
That's me.
Mr. Jones, that is you. And Mr. Jones, would you be so kind as to tell me what the heck is a lymphocyte? Is that like a website?
No,
Okay.
I was confused as well. It's actually a white blood cell,
Yes, it is.
which is created in the bone marrow, and then you can find them in blood and lymph tissue.
Yes.
The two main types of lymphocytes are B lymphocytes and T lymphocytes. The B lymphocytes make antibodies, and the T lymphocytes help kill tumor cells and help control your immune response. About 25% of all white blood cells are lymphocytes. And I thought this was kind of strange, but the immature lymphocytes travel to the thymus to mature, and that's why they're called T cells or T lymphocytes. And once they are matured, they travel to the lymphatic organs to defend the body.
Perfect.
And that's all I got.
Sir, that's all you need to have. Yeah. For those of you who like to break words apart, cytes means cells. So these are lymph cells, and they happen to be white blood cells, lymphocytes. That was awesome, sir. Thank you. Second one. Miss Lee.
Hi.
Miss Lee, where on my body can I find lots of lymph nodes?
The lymph nodes are located throughout the body, including the neck, armpit, growing around the gut, and between the lungs. The lymph nodes join lymph fluid from nearby organs or areas of the body. That's all.
That's perfect. No, Miss Lee, I wouldn't want more. That was right. She's right. Don't go on. That's perfect. She's right. So there's lymph nodes everywhere. Remember, everybody, there's not just one, right? There's a whole bunch along the lines. And Miss Lee's right. They are found everywhere in the body. There are higher concentrations in the neck, the axillary region, the abdominal region, your chest, your inguinal region, your knees and elbows to a lesser extent, the places you bend. Well done. Thank you, ma'am. Mr. Lee, are you there, sir?
Yes, sir, I'm there.
Mr. Lee, can you tell us what the cisterna chyli is? Is that a...
No.
No. Did you? That's honest. I appreciate that.
Same question with Miss Lee, with my wife.
No, Miss Lee had the main locations of the lymph nodes. You had, what is the cisterna chyli?
No, let me check.
You're going to check?
Oh, God. Where is it? I took a picture yesterday. So my question is, where are the lymph nodes located?
Oh, well, with all due respect, you're wrong, but that's okay. We will come back to cisterna chyli. Kylie. I'm saying it wrong. It's Kylie. All right, everybody. Essentially, by the way, everybody, really simply put, it's an area in the stomach where lots of your lymph comes together, and there's loads of lymph nodes. And it's called, there's just a huge lymphatic area here, which makes a lot of sense. And it's called the cisterna chyli. I always want to say it wrong. Thank you. All right, Mr. Ma. Hi, Mr. Ma. Mr. Ma, I can't hear you though, sir. You're muted.
can you hear me, sir?
I can hear you now.
Okay.
Mr. Ma, what is MALT? Mucosa associated lymph tissues. I don't, what does that mean? Where'd you go?
Okay.
Oh, there you are.
I'm going to share the definition about
oh, please.
Mucosa associated lymphoid tissue. So the mucosa associated lymphoid tissue is also called mucosa associated lymphatic tissue. It is a diffuse system of a small concentration of a lymphoid tissue found in various submucosal membrane, a membrane size of the body, such as the gastrointestinal tract, nasopharynx.
Pharynx, you're right.
Yeah, thyroid, breast, lung, salivary glands, eyes, and skin. So I'm going to call this name is MALT, make it short.
Yes.
The MALT is populated by lymphocytes such as T cells and B cells, as well as plasma cells and macrophages.
Macrophages, yeah, or phages.
Phages, okay. So each of which is well situated to encounter antigens passing through the mucosal epithelium.
Epithelium, yeah, that's a hard
epithelium.
one. Yeah, poor guy.
In the case of intestinal MALT, M cells are also present, which sample antigen from the lumen and deliver it to the lymphoid tissue. MALT constitute about 50% of the lymphoid tissue in human body. That's it, sir?
That's it, yeah. So the point they're trying to make, everybody, is this mucus that you make inside your nose, inside your gut, inside your intestines, inside your all that stomach and stuff. It also has it's also got lymphatic tissue in it associated with it, and it's got white blood cells and things like that. So your mucus is good. It's trying to catch foreign invaders and destroy them. And this is this is mucosa associated tissue, the tissue that makes mucus. They oftentimes throw tonsils in here too, and adenoids and things like that. Things that are meant to kind of capture this stuff. So that goop that we all think is so gross is actually our friend. Yes. Thank you, Mr. Ma. That was great. Oh, and by the way, three of you have mentioned, at least three of you have mentioned macrophages so far. For those of you that like words broken apart, Miss Creel, macrophages means giant or big eater. Macro actually means big. Micro means small. Macro means big. And phages means eater or, yeah. And these are Pac-Man cells. They're, again, for those of you who like video games, these cells literally eat foreign invaders. They actually eat them. They actually surround themselves around them and then digest them and break them apart. So they're macrophages, and they're giant eaters, and they tend to like to eat foreign invaders and just cells that have gone rogue or whatever, and they surround them and destroy them. That's why you keep hearing about them in your defense system, macrophages. This is a perfect place to pause. It's 9:31. We'll be back at 9:46. Thank you all. Next, tell us briefly what the spleen is.
The spleen is the largest lymphatic lymph organ. Okay, hold on, I have my flashcards mixed up.
Yeah, no, you're doing fine, sir. Just, do you have,
The line,
Mr. Do you have some music playing in the background or something?
oh, is the phone ringing?
There's something overriding you.
Really?
Yeah.
Still, or? You hear me, or?
Oh, I could hear you actually just fine. Just so you have this kind of thumping or something in the background. But go ahead, go for it, sir.
Okay. It lies between the fundus of the stomach and the diaphragm, extending between the 9 to 11. I don't know what it's calling today, sorry.
it is a. Espérame, estoy en la clase. Hold on.
I got you. It's like, Mom, doing my class presentation. That's all right, sir. All right, so the spleen, you were telling us where it's located.
It is a hemolymph organ and belongs to the reticuloendothelial system. The how do you say that? Reticuloendothelial system.
I've never heard of that. That's why I was like, I don't know.
Its oral cavity separates the spleen and diaphragm from the ribs, and its main functions, in simple words, is the spleen stores and filters blood and makes white blood cells that protect you from infections.
That's actually the highlights, yeah. It's over on the left-hand side of your body. Don't get stabbed there, anybody, because that's where your extra blood is. It is a blood filter. It also makes white blood cells. And yeah, it's a giant lymph node. It really is. Thank you, sir. Miss Osuna.
Yes.
Miss Osuna, can you tell us about your tonsils or somebody's tonsils? Yeah.
Tonsils are located in the oral cavity and the pharynx. Tonsils are fleshing pads located at each side of the back of the throat. Debris frequently lodges in the pits and causes inflammation, a condition called tonsillitis. The function of the palatine tonsils is thought to be associated with preventing infection in the respiratory and digestive tracts by producing antibodies that help kill infected agents. And frequently, however, the tonsils themselves become the objects of infection and surgical removal, which is tonsillectomy, is required, which sucks. The recovery sucks. And that's it.
That's perfect. So you have had a tonsillectomy.
Yeah, I have.
Yeah.
A while ago.
Yeah. So yeah, again, it's not they're not important to everybody, but they can be removed because you have so many things in your immune system that you can usually get away with it. Yeah, very cool.
Yeah, I was getting sick though like every 2-3 weeks. So.
Yeah.
That's not fun.
No, that's not fun. Thank you, ma'am. Thank you, thank you. Mr. Overman, Pear patches?
Yes, sir. Pear patches are groups of lymphoid follicles found in your small intestines. Follicles are similar to lymph nodes. They're small organs in your lymphatic system. Peyer's patches are also known as intestinal tonsils since they work similarly to tonsils. The purpose of the Peyer's patch is to analyze and respond to pathogenic microbes in the ileum region of the small intestine. This concludes my.
That's perfect. Sir, I didn't know that. I really like that. Thank you. It's tight and accurate. I never thought of them as being tiny tonsils, intestinal tonsils. I like that.
Yeah, I thought of that myself when I read it on a website.
Yeah, you thought of that yourself when you read it. I got you.
When I read it on the website.
Yeah, I don't know. It's just a very good way to think about it because that's exactly it. I don't know. How did I not know this? All right. I don't know who's going to school here, you guys or me. Miss Pugh. Miss Pugh, I know you're unmuting, I can see. Hi. Hey, you're basically going to tell us about the appendix, right?
Right. The appendix, formerly the vermiform appendix, is a vestigial hollow tube that is closed at one end and is attached at the other end to the cecum, a pouch-like beginning of the large intestine into which the small intestine empties its contents. It is not clear whether the appendix serves any useful purpose in humans. Suspected functions include housing and cultivating beneficial gut flora that can repopulate the digestive system following an illness that wipes out normal populations of these flora, or providing a site for the production of endocrine cells in the fetus that produce molecules important in regulating homeostasis, or serving a possible role in immune function during the first 3 decades of life by exposing leukocytes to antigens in the gastrointestinal tract, thereby stimulating antibody production that may help modulate immune reactions in the gut. And there is a general agreement among scientists that the appendix is gradually disappearing from the human species over evolutionary time. And last of all, blockage of the appendix may lead to appendicitis, a painful and potentially dangerous inflammation.
That was perfect. Thank you. I didn't know about it disappearing slowly. A lot of scientists think it's going away, huh? Wow. Yeah. Yes, I've always been told that it's there as a backup holder for bacteria. If you ever have your floral, which is all the good bacteria that lives in your intestine, wiped out, it'll help repopulate that. Very cool. Thank you, ma'am. Perfect. Beautiful. Ms. Rader, again, I'm sorry. I asked Ms. Rader to tell us about resistance. And by the way, you can take entire college courses on how you have specific and non-specific immune resistance, entire courses. And so I said, hey, in 10 sentences, do what some people do in 5 months. And that's what she's going to do. So please tell us about specific and non-specific resistance.
Okay. Let's see here. Can you see my screen?
Yes.
Okay. All right. No, it's still acting weird on me, so let me just do this. I'm gonna stop sharing.
Yeah, go ahead.
I'm just gonna read it. So, resistance is the body's ability to counteract the effects of pathogens and foreign agents through defense mechanisms that are either non-specific or specific. So non-specific defense mechanisms are directed against all pathogens and foreign agents and include barriers, cellular responses, and inflammation. Physical and chemical barriers are the first line of defense and include things such as unbroken skin and mucosa that provide a physical barrier, as well as skin glands that secrete sweat and sebum that provide a chemical barrier against pathogens. Cellular responses are the second line of defense and involve reactions from non-specific white blood cells and plasma proteins that destroy microorganisms that penetrate the first line of defense. Inflammation is a protective response to tissue damage, and its purpose is to eliminate pathogens, foreign agents, and create an environment that maximizes tissue repair. There's local or acute inflammation. It's contained to a specific area and characterized by swelling, heat, loss of function, redness, and pain, and generally only lasts a short time. But if it lasts longer than 2 weeks, it would be reclassified as chronic inflammation. Systemic inflammation is widespread. It's not confined to a specific region, and it's generally associated with infection, accompanied by a rise in body temperature, which is called a fever, that increases metabolic reactions that combat pathogens. Specific defense mechanisms are selective and are directed against particular pathogens, and they provide immunity and involve B cells and T cells. T cells are responsible for cell-mediated immunity and directly attack invading pathogens or foreign agents. And B cells are antibody-mediated immunity, and they provide surveillance and produce antibodies when they encounter a foreign agent, and the antibodies attack the agent or direct other immune cells to attack it. And that is all I'm allowed to tell you because that's 10 sentences.
I'm sorry, Ms. Rader. That was fantastic. Fantastic. So essentially non-specific is when you lock your house and you set the alarm, no matter who tries to get in that house, even if there's somebody you like, the alarm's going to go off or whatever. They're going to have a hard time getting into the door locks. Specific is like a security guard, right? That is going to recognize things, focus on people that look sketchy as opposed to people that don't, things like that. That's specific. I love that. Thank you, ma'am. Sorry. And that's all I'm allowed to tell you. Mr. Richards.
Yes, sir.
Mr. Richards, you want to tell us about inflammation?
Yes, Miss Rader has just covered mine, so...
yeah, she actually did touch on it. Yeah. So, but anyway, Tell us more. Tell us again. Tell us whatever.
So, inflammation is a protective response to tissue damage resulting from a variety of causes, including infection and trauma. Inflammation can be classified by its extent as local or systemic, or by its duration as acute or chronic. Local is also called acute, which is inflammation in a certain area or region. Systemic is widespread and usually an infection. Chronic is when inflammation lasts longer than 2 weeks, and inflammation is when white blood cells go to war and kick ass.
I like that. Yeah, well done, sir. That's perfect. That's absolutely perfect. Thank you. Miss Savarino, this is a tough one too. Miss Savarino, T cells and B cells. Hello.
B cells and T cells, both are white blood cells with different roles. B cell production and maturation occur in the bone marrow, and they stay outside of the lymph node. And then whenever the B cell matures, they enter the bloodstream, where then they facilitate defense mechanisms against intruders. And then the T cell production is in the bone marrow, but they mature in the thymus, and the T cells are inferior to the lymph node. And then once the T cells mature, they enter into the bloodstream, and then they travel to the lymphatic organs, where they are also facilitating defense mechanisms. So a good way to remember the difference in B cells and T cells is by where they mature. So B cells is bone marrow, and the T cells is the thymus.
I love that. That's
all I got.
No, that's perfect. That's perfect. Yeah. And they both help your defenses just in different ways. Yeah, I love that though. T cells thymus, B cells bone. Thank you. Yeah. Mr. Singletary. Mr. Singletary, yes, you're raising your hand. That means I am struggling with something, right? Mr. My mic just went out. Aha, a likely excuse, sir. Would you like us to come back to you in just a second, sir? Would that help? Please, absolutely. I think that's a good reason to come back to you. All right. Mr. Snell.
Yes, I'm here.
Thank you, sir. Mr. Snell, will you tell us about allergies, sir?
Yes, I can. Okay, so what is an allergy? An allergy is it occurs when someone's immune system reacts to a substance in an environment that could be harmless or could not be harmless to most people. And those substances are called allergens, and they're found in pets, insects, pollen, mold, foods, medicines, different things. And then reactions vary from person to person. So when people with allergies are exposed to allergens, they may develop a reaction which will lead to inflammation that can happen in the skin, lungs, eyes, or nose. And yeah, some common symptoms would be like itching, rashes, red eyes, and that's about it.
That's perfect. Yeah, allergies are essentially your body usually overreacting to something it recognizes as foreign, and it's right, it's foreign, but it's not usually that dangerous, and it overreacts, and so you get allergies. Cool, cool, cool. How are we doing, Mr. Singletary?
Can you hear me?
We can hear you, sir, loud and clear.
Okay.
Your mic has been fixed.
Sorry.
Don't be sorry, sir. That was perfect. I like how you raise your hand. It lets me know you're there and we're working on something.
Yeah, I could hear you, but I couldn't say anything back. Just a little question mark went right next to my mic. I said, now.
Yes. Well, Mr. Singletary, since we can hear you loud and clear now, would you be so kind as to tell us about HIV and AIDS?
This was a difficult one for me to do, Mr. Tapscott, because this hit home because I lost a lot of my friends to this
Yes, I truly.
I wasn't gonna do this.
Yeah, I'm sorry, sir. Sir, by the way, I truly assigned these at random, but that thought went through my head as I assigned it. I was like, this could be a very sensitive subject. Yeah.
Okay.
And I'm sorry about
Was
that.
identified in 1981. HIV is a virus that attacks the cells that help the body fight off other diseases and infections, making that person more vulnerable to diseases. The HIV disease is commonly spread by contact with certain bodily fluids of a person, mostly through unprotected sex or the sharing of injection needles.
Take your time, sir.
As the virus continues to increase in the body becomes more weak. As your CD4 cell counts become more susceptible to other diseases. Regrettably, if the virus is not treated in the early stages, it can lead into AIDS. AIDS, which stands for acquired immune deficiency syndrome. This disease is the last stage of the HIV strain. The AIDS disease occurs when our bodies become badly damaged and can no longer fight off infections to the body. A person can only progress to the stage of AIDS if the human body's CD4 count, that's basically your white blood cell count, falls below 200. A normal person's CD4 white blood cell count is between 500 and 1600 millimeters. Statistically, in the United States alone, more than 700,000 people have died from the disease from the gay, bisexual, African American, and Latino communities, which were being disproportionately affected by this disease in the 1980s and 90s. That statistic and demographics has dramatically changed as the virus continues to spread among all demographics and communities. Without medication, a person can only expect to survive possibly up to 3 years. In most cases, without medication, the life expectancy is only about 1 year. And that's all I'm going to say.
Mr. Singletary, I'm very sorry about how hard that was to talk about, but I'm really glad you delivered that because I think it's important we recognize all the stuff we talk about in this class has people behind it, right?
At first, I thought you picked this specifically, but I did not realize you didn't do that on purpose.
It was literally the alphabetical order, yeah.
It just happened to be my time, so.
Yeah, it wasn't. But I did think about it as I did it. I was like, oh, this could really hit close to home. But and I'm so sorry it's so painful, but thank you for humanizing something, right? It's important we know.
Back then, it was really difficult. A lot of my friends, they were given a drug called AZT, and all it was really doing was to give them a little bit of time.
Yeah.
And you knew after maybe a year, they were going to be gone.
Yeah.
So.
Yeah, and there was not a lot of medical attention given to it, right? It was, it's not like we yeah.
I was talking about it with Mr. Overman yesterday, and he's like, yeah, I never hear much about it. I said, no, because we have a lot of new drugs out there now, and we know how to not necessarily defeat the disease, but more so how to protect the cells from the disease.
Yeah.
So we don't hear about people dying of AIDS anymore.
No, yes. And thank you, sir. That's exactly right. We've gotten better at living with HIV. Yes. And by the way, everybody, I've worked on clients that have HIV. Some people glove up, but I don't even do that. It's actually a very hard disease to catch if you're not having fluid transmission, which you wouldn't be with a client.
Right.
And the point that Mr. Singletary made, but it's kind of an important point just medically speaking, is AIDS is really when HIV has attacked the immune system enough to knock it down to where now you're showing symptoms. And people don't die of HIV and AIDS, they die of some disease that they can no longer fight off.
Right.
This is like when people say they died of complications of the coronavirus. You know, it's not so much they die of the coronavirus, but they tend to die of the other things that happen while their body's being broken down by the coronavirus. It's that kind of, I don't mean to compare the two, they're very different, but it's still that kind of concept. Thank you. Thank you. Thank you for putting an emotional side to that presentation, sir. Thank you, thank you.
Thanks for listening.
Okay. No, where am I? Oh, yes. Miss Stevens. Miss Stevens, will you tell us about chronic fatigue syndrome?
I would love to.
Thank you.
This disease is characterized by profound fatigue, sleep abnormalities, pain, and other symptoms that are made worse by exertion. The main symptom is fatigue for over 6 months. The fatigue often worsens with activity and doesn't improve with rest. People that have this disease feel unwell and feverish, have a sore throat and swollen lymph glands. There is no cure, but treatment does help with like antidepressants, therapy, and relaxation techniques. There's no like reasoning, I guess, on why people get it. But some people think that it comes after like flu-like illnesses or other infections.
Yeah, that's all I've got too. I've had clients that have it, and some of them were very active before they got it. Like they almost ran themselves down. I don't know if that's the case, but it really, like they were some of the most active people I've ever known, like too active, and they got chronic fatigue syndrome. And man, they'd have to kind of plan out their lives. If they did something, I don't mean something big. I mean, if they were like, we're going to go to the mall today, that knocked them out for about 3 or 4 days after. Like they had to really plan their life, what they wanted to do and such. Thank you. Mr. Thornton.
Come on, Scott, give me a break. No, I'm just fine.
Lymphedema, sir. This is an important one.
Lymphedema, what is it? It occurs when the lymph vessels are not able to adequately drain lymph fluid, usually from an arm or leg. The most common cause of lymphedema include cancer. If cancer cells block lymph vessels, lymphedema may result, such as swelling of the arms or legs, pain in those areas. You can treat them by wrapping a bandage or compression garment as well can help reduce swelling and get lymph fluid moving back up from your legs towards your heart. Exercise specific gentle lymphedema exercises for the legs can help improve lymph fluid drainage.
Beautiful.
And we're done.
It's swelling. It's swelling, right? It's your.
Yeah, it's just swelling. Like you can get it in your arms and legs. Basically, like there's people you've seen when one of their legs don't match the other. Those are the causes from that. And I've seen people like that in person.
Yes. And what am I worried about if one leg is more swollen than the other and it's painful and hot and such?
Wait, what? Say that again.
What am I worried about if one leg is swollen and the other one's not? If I have this uneven swelling in legs, what is one of the things I might worry about that's life-threatening?
Shit, I might lose that leg.
Well, yes, you might. You might actually have something worse than that. You might lose your whole body. But Mr. Bose is going to tell us. What am I worried about, Mr. Bose?
Deep vein thrombosis.
Yeah, I'm worried about a blood clot in my deep vein. Yeah, that wasn't part of your presentation, Mr. Thornton. I'm sorry, I just threw it in there. But yeah, deep vein thrombosis. Thank you. Cool. By the way, some lymphedema can be quite serious if it's because your lymphatic system's not working, right? If your lymphatic system's not working, you get swelling because lymph's building up and your lymphatic system isn't bringing it back, and that's really, really serious. Okay, Miss Young. Hello, Miss Young. Miss Young, can you tell us what systemic lupus erythematosus is?
Okay, I'm glad you said it because I totally forgot.
Did you see how carefully I said it? Like, it's always the erythematosus that throws me off. But anyway.
It's okay. There's a short way of saying it.
Oh, good.
So, systemic lupus erythematosus, also known as SLE lupus, see,
is an inflammatory disease caused by the immune system and it attacks its own tissues. SLE can affect the joints, skin, kidneys, blood cells, brain, heart, lungs. It can also cause fatigue, joint pain, rash, and fever. And I've got so many symptoms. I don't know if we want to go through them all.
Maybe not. What did you just say? I'm sorry, I didn't catch the last part.
I said I have so many symptoms from this. I don't know if we want to go through them all.
No, just give us 3 highlights.
All right. So, and if it's left untreated, it may also result in heart attack, stroke, or kidney damage.
That's
and you don't have to worry about catching it because it's mostly passed through genetics. And it also said environment, but I didn't really find anything on any sort of environmental issue.
Yeah.
Massage is contraindication during periods of exacerbation or if fever or any new signs of symptoms develop. During periods of remission, a gentle massage is indicated, avoiding areas with rash, and about 1.4 million people in the U.S. are affected, and most of them are women.
Yeah. You women and your autoimmune diseases, yeah. Yeah, it's a disease where the body is attacking itself. And by the way, we would never work on somebody with a fever because that suggests they're fighting off something throughout their whole system, right? Well done, Ms. Young. I believe that's everybody, right? Yeah? Uh-huh. Sorta? Kinda? Okay. We actually got through presentations in 1 class. That's very impressive. And we still have time left. You have a tiny bit of homework that I'm going to release in just a minute so that you can get it done before the end of class. I just want to give you a preview of coming attractions. Because your homework is on Chapter 6. It's Introduction to Chapter 6 of the Trail Guide, which is the pelvis and thighs. If I were to tell you that I was excited about this chapter, that would be an understatement. We've been learning about stuff above the waist, right? We have learned about actually all sorts of muscles above the waist. We haven't done the face and we haven't done some intricate neck muscles yet, but we've essentially done the entire thoracic region and the upper arms. We've explored the meat between your ribs, which is the internal and external intercostals. We've explored 3 other breathing muscles that go along with that. The posterior serratus anterior, posterior serratus inferior, and the diaphragm. We've talked about all the muscles that lock down the thoracic region to the hips and actually attach the thoracic region to the hips, which is your abdominals. The rectus abdominis, the transverse abdominis, the internal obliques and external obliques, and the quadratus lumborum. We've talked about your giant spinal erectors, your erector spinae muscles, your spinalis, your longissimus that goes all the way up to the mastoid process, and the iliocostalis that attaches the hips to the ribs as well. We dug underneath that and we looked at the shoelaces of the back, the multifidi and the rotatores. We even went deeper than that and looked at the intertransversari and interspinalis muscles that go in between some of these slots in the cervical and the lumbar region. We looked at the muscles that move the scapula, and we talked about all the muscles that go along the medial border of the scapula and attach it to the thoracic region so that I can elevate and depress and you rotate up and rotate down and protract and retract, or abduct and adduct. Muscles like the rhomboids major, minor, levator scapula, and serratus anterior that attaches to the medial border but from the front. We looked at the rotator cuff muscles that actually help my arm hook onto my scapula. We looked at the supraspinatus, infraspinatus, and anytime I say infraspinatus, you say teres minor. And we looked at subscapularis. We looked at the latissimus dorsi, this gorgeous, gorgeous muscle, can't even be overdeveloped, bird-like muscle that comes sweeping up from the thoracolumbar aponeurosis, reaches underneath the arm and grabs on the front of it, and allows you to do powerful adductions of the glenohumeral joint, powerful extensions of the glenohumeral joint so we can climb. Absolutely beautiful. We learned about Other muscles here in front, like the pectoralis major, we learned that that attaches to the arm, and because of its unique fibers, can actually help me do extensions and flexions and all sorts of stuff, but mainly we think about it as a horizontal adductor because we use it in push-ups and bench press and punching and stuff like that, and massaging, by the way. Pectoralis major all day long, right? We learned about the pectoralis minor, which is nothing like the pectoralis major. The pectoralis minor actually attaches to the coracoid process and hooks that to your ribs. We learned about this symbol here because we know it's got 3 strands and it attaches to ribs 3, 4, and 5. We learned about other muscles that attach to the coracoid process. We learned about the coracobrachialis, which is a tiny muscle that goes between here and the medial side of my arm about halfway down. It also helps with horizontal adductions and flexions as well. And we learned that one of the heads of the bicep actually likes to attach to here as well. We learned that underneath the bicep, you've got another muscle called the brachialis, and we actually learned that the bicep, even though bodybuilders have been telling us it's this amazing thing, the brachialis is actually bigger and more powerful, and it's underneath. We learned that the backside of your arm has a 3-headed muscle called the triceps, and it's amazing. We learned that one of those heads actually crosses over the glenohumeral joint, can actually affect adductions and extensions of the shoulder, even though its main job is to do extensions of the elbow. We learned about really cool neck muscles that come up here and go out diagonally, like the splenius capitis. We learned about another muscle that comes out and hooks in the neck, splenius cervicis. We learned about the speed bumps of the neck, the semispinalis capitis. We learned about some of my favorite little teeny weeny muscles, which are the suboccipitals. Right back in here. Take up this little space back here. They're the headache muscles. They're absolutely amazing. They allow me to do little bobbly head stuff all day long. Super important. Yeah. We learned about the significance of stuff that attaches to one area. So we learned that there are really high priority targets in the body because a lot of stuff happens there. And some of these high priority targets, one I already talked about, which was the coracoid process, because 3 muscles come right in there, which is why we like to rub people in their chest right up here, because we help release their shoulders that way and all sorts of stuff. But we also learned that there are other high priority targets. I would say the medial border of the scapula is a high priority target. You hit 4 muscles there. Yeah? Absolutely. We said the mastoid process of the temporal bone was a high priority target because the longissimus attaches my butt to my head, and then the SCM, the sternocleidomastoid, my prayer muscle, hooks up here in front. Yes? And we learned that the semispinalis capitis comes out here diagonally and grabs onto that sucker. We also learned that there's a suprahyoid, which we haven't done yet, and we will do later, much later, but there's a suprahyoid bone that actually hooks my hyoid back to that sucker, way in deep. So this is a very important area. I would say this whole back of the head, because of the suboccipitals and those other 3 muscles I just mentioned, is a super important band that you should be rubbing on everybody. I mean, you should go up to strangers at bus stations and just start rubbing them back there. They'll thank you for it. You might go to jail, but it's still the right thing to do. So high priority target, high priority target, high priority target. We learned that stuff. And we also learned that down here around L5S1, that you can go to town down here. You got the thoracolumbar aponeurosis, you've got all these spinal erectors coming together, you've got the multifidi that actually cover the sacrum, and the glutes actually come up into here, and everything weaves in here, and this is a really critical area to really, really massage. And we learned some fancy stuff that they don't actually talk about in a lot of schools, like just about how to improve breathing, that we can move the ribs around and open them up, and about all the breathing muscles, which I already talked about. So that's kind of cool stuff, and we will review that stuff. Believe me, we will review that stuff. But really, all of that, all this stuff up here is so that I can do stuff when I get to you, right? But I have to get to you first. And that comes from the carriage below, right? Yep. Everything important in life happens below the waist, like life itself, right? So, well, we're going to talk about the pelvis and thighs now. And they're so critical, so exciting, I can't even tell you, because this spine of 24 vertebrae stacks on top of my pelvis. Now, that may not sound like a big deal, but if I take my pelvis and it changes at all of a sudden, all my curves up here change. If I'm off at all in my pelvis, look what happens. I'm not doing that on purpose. If my pelvis comes up here, my head has to come over. I have to do stuff like this. If it's tilted too far back, I kind of sit back here and my spine kind of goes way too far up here. I start to look like a duck. All of those things are critical. Most back problems aren't back problems. They're pelvis problems. Okay? So, let's remember Elvis. You know what they used to call Elvis, by the way? Elvis the pelvis. Because when he first came out, he would do these gyrations with his hips. And they thought it was quite salacious at the time. But anyway, pelvises are everything. And we are going to be looking at that. We're, of course, going to be looking at the thighs because they tie into the pelvis. And when they are tight, they can actually affect my pelvis. And once again, I'd like to say that many back problems are really leg problems. And this is something many massage therapists miss. Everybody can rub a back. It's a nice, flat, essentially table for you to work on. Whoopie-doo-dah. If I had to actually rewrite this program, I'd have you learn back at the end. Because I've never met a therapist who can't do a halfway decent back rub. But leg rubs? Oh, very tricky. Legs and arms are actually very tricky. So I'm excited that we're getting to this area and that we are working down. So we were working on everything so far. We are in the beautiful penthouse at the top of this beautiful skyscraper, but now we're going to start heading our way down the foundation and figuring out what holds up the building. And so I just wanted to hopefully get you as enthusiastic as I am about this. This is a very complex area of the body we're going to, and the lower you go, the less change is required to create a big problem up top. Right? If somebody's walking on stilts and I mess with the very bottom of their stilts, it's a big problem up there. And so we actually, as we go lower, we get to more important stuff. If there's a problem with my ear, it does not affect my back. You can mess with this all day long, right? But if I've got a rock in my shoe, that's a big problem. Really is, even a tiny rock. So that's kind of where we're headed right now. I'm going to release the homework for that. You will easily be able to finish it by the end of class. I'm sure you will spend the rest of your time reviewing old muscles that we've gone over and all that good stuff. I'm very excited about this next leg of our journey, no pun intended. And let me do that right now. Let's do it. It is intro to chapter, it's number 43 assignment, trail guide, intro to chapter 6. Let's see here, come on. Get on back. You should all